Hello and welcome back to LTC Heroes Live by Experience Care. This week we are at Intely at Sea 2022. I'm joined today by Kim Riffle, and today's show is sponsored by Intely Care. Kim, welcome to the program.
Thank you.
Kim, you and I have already been talking a little bit before we hit record about your story, and it's a unique one. But I want to go back to when you first got into long-term care. I call this the initiation story. Is there a specific person who pulled you in? Was it a specific moment? Was it a volunteer? Was it something that happened in your life? Tell me as much as you can remember when you first got into our industry.
I actually started out as a CNA in New York in a hospital and worked there, and then got my license there as an LVN. And I went to Germany and I didn't renew my license. So when I moved back to Ohio, I went back to school and got my license again. So it was kind of a long haul. And I started in long-term care probably. I did a lot of in-home nursing first, and then I did long-term care probably the last 4 years.
What is it about long-term care that drew you to it?
Just the need. There's a really huge need for nurses, and we're so short nursing, and it makes you. I don't know if this is just a nursing thing and a CNA thing, or but we have a tendency to not say no because the need is there, and it's really hard not to go in and do your job.
I would agree. Saying no is not a strength
No.
of long-term care nursing professionals.
It's not at all.
Tell me about what the last 3 years have been like for you. When LTC Heroes decided to do something with Telecare, I specifically wanted to document what the frontline caregivers were doing and what we learned from this process about our system, about our elderly, about the hard work. I want to make sure that doesn't get forgotten. Tell me where you were, what your experience looked like, what you're going to remember.
Probably the biggest thing I remember is I wish in nursing school they would have taught us how to be more innovative. And when I say that, I'm talking about the shortage of supplies. We had to flush catheters with whatever we could find that was sterile. I was using 10 milliliter little bottles and putting them in sterile containers and IV bags. I mean, you can't not flush them. So that was the biggest thing, I think, is just the supplies. We had no supplies, and I still to this day I don't understand why we did not have enough supplies. And I think that was probably the biggest hurdle we had. That, and unfortunately a lot of nurses, they said we didn't sign up for this and they quit. And I'm floored because I'm like, yes, you did. That is exactly what we signed up for. There's a lot worse diseases than COVID, so it was kind of a sad thing watching a lot of people quit. So it made the shortage even worse. And, I'm walking into facilities as an agency nurse. I have a limit. I won't take more than 40 patients because that's unsafe. And the other thing, I walked in with another IntelyCare agency nurse, and they told us that 2 nurses called off and we were going to have 100 patients apiece. And we're like, oh, no, we're not. No, you get somebody else in here, because it's not safe. It's not safe for us. It's not safe for them. It's wrong. And I think the hardest thing is just actually not being able to give them the time and attention they deserve. You have 40 patients. It's impossible. They give us 6 minutes per patient, which I think is nuts. I'll take my breaks. I'll take a break and split it up in 10-minute intervals, and I'll go and just to talk to residents that need to be talked to, or go take care of something. It's just been really, really rough. It's rough to watch. It's a really rough field to do. It's very stressful.
Are there for those peers of yours, colleagues of yours who didn't quit, who stuck through it like you did, What do you have to say to them? What do you think of them
Oh,
after
I
coming
think
to
they're awesome. Absolutely, hands down, awesome.
Hmm.
Thank them.
What type of attribute or character do you think is needed in our field right now to be a CNA or an LPN or an RN?
Compassion.
Hmm.
Compassion's the biggest one.
Mhm.
You have to think of somebody other than yourself. You know, I mean, if you can't think of another human being other than yourself, then you shouldn't be in the medical field at all,
Mhm.
because it really takes a lot of compassion and giving. And you've got to remember to give back, pay it forward. It's not just about, it's not about passing pills. And I tell people this all the time. Our med pass is insane. Sometimes it's a 12-hour med pass, but um, it's not about the pills I'm giving them. It's about the actual nurturing, giving, and caring for them. And I've been lucky. I've had a few places I've worked. I had one place I was bored at. I had 7 patients. I'm like, what? But I gave them the best care. I talked to them all day. I mean, they had really good care. It was excellent. It was the way it should be.
One of the things that I love talking to long-term care professionals about are their stories. Do you have any specific stories from residents that either made you laugh or a story that you'll never forget, that you'll go to your grave with, that this person tickled you, or someone that thought that they called you their girlfriend or your sister, or they projected
I
you
get
as
that all
their
the time.
mom? Any stories that kind of stand out for you that you're proud of?
I have some, but not that I could share. Because I also work with schizophrenics
Yeah.
sometimes, which are the fun ones. You know what I mean? There was but there was one young man that and he was mostly a teenager, but his lithium level was, we were trying to get it balanced out, and he he was funny, and he would just do things, and he took his computer that they just bought him and stuck it in the trash can, and then he put it in the shower, and I was just, and he comes out, he was just, my computer, my computer, my computer. I'm like, what's wrong with your computer? And I go in there and I'm like, oh my gosh. you know it's just, you just don't know what they're gonna do, you know what I mean? And it's just sometimes it's just a surprise,
Hmm.
um I think the best memory that I'm going to have is I had never put in a whole trach, and this kid pulled the entire trach out, and his stats dropped down really low, and like he was in the 50s, he was going to die if I didn't do something. So I'm like, I panic. I'm like, oh my gosh, one up, one down, because you got to be able to replace it. And I'm like, oh geez. So I flipped on YouTube, and that's how I put it in. I honestly did.
That's a great story.
I watched the YouTube, and as I was watching it, I put it in, and then we sent him out to make sure the placement was good. And the doctor calls me and he goes, I'd like to speak to the nurse that put this trick. And I'm like, oh, that would be me. Listen, I've never done one before. And I'm apologizing left and right.
Right.
And he's like, no, he goes, it was imperfect. And I'm like, really? I'm like, all right. Good for you too. You know what I mean? It's just
The
funny.
YouTube School of Medicine.
Yes, nurses 101. Go to YouTube.
I'm interested in your mentors when you were getting into healthcare. Is there someone who taught you how to handle stress, how to make decisions, how to communicate? Is there anyone in your past that you're like, this person helped me be who I am today?
Oh, it'd be my dad. My absolutely hands down. Um, he he taught me to speak my mind. He did listen, and he was a little chauvinistic, but not terrible. If I danced with my dad, he would go, "Are you leading or am I?" I'm like, I don't know, maybe me. So he let me do, me,
Hmm.
which I think was great. And I wanted to be a nurse since I was in 7th grade. So he's the one who pretty much got me going in that direction. And I think that's probably the best person.
What's your favorite part of the day? I always think of a quote from a football player named Ray Lewis, and he said, "You pay me Monday through Saturday. Sunday I work for free." What would you do for free? What's your favorite part of caring for the seniors in our country?
I take my 30-minute lunch break that I don't get paid for, and I go talk to them.
Do you really?
I really do. Yeah. Like I'll take it and I'll split up 10 to 15. It depends. If it's somebody that really needs to talk to me, then, it might be 20 minutes. But if I have a gap in my day and I've got all my stuff done, which occasionally happens, then I will do that. I'll go and I'll talk to a resident and just spend that time talking to them. So I guess my lunch is my free.
Do you know where that compassion comes from? Your interest in our senior communities? Were you
Honestly,
born that way?
I guess, yeah. I started out as a candy striper back when I was in 7th grade.
What's a
And
candy striper?
a candy striper, no, I know that's like so old term. A candy striper was volunteers. We did it for free. We worked in the coffee shops in the hospital. We delivered flowers. Um, it it was just in 7th. You had to be at least 7th grade. I think 14. I think you had to be 14 in order to do it. And we wore little uniforms they look like candy canes. So
I didn't know that.
yeah.
The candy stripers don't exist any longer, do they?
No, they don't. It's a shame that they don't. And it was a good free job, you know what I mean? And giving back to the community. And I think they should have kept them.
And where I grew up in Kansas, we spent a lot of volunteer hours going to nursing homes, and I interviewed the chief medical officer of American Healthcare Association, Dr. David Gifford, about 2 months ago, and he specifically said, I said, "What job is missing in our industry?" And I think he essentially said the candy stripers. He said hallway ambassadors. They don't need to be CNAs. They don't need to be 16.
Right.
These people talking to people, filling up people's water with a certain amount of ice that they want, or putting the right amount of cream into it. You don't need a medical degree for this, and
Right.
you're going to make this person's quality of life way better.
Yes, and that's what we did. Those are all the things we did.
Mhm.
And we worked the coffee shop for free. So they didn't have to pay personnel in the coffee shop, which makes a whole lot more sense,
Mhm.
And the tips, we did get tips, but we took those tips and we gave them to some organization, which I don't remember now, but it was pretty nice.
Kim, I'm gonna read you some quotes. I'm gonna pause for a small commercial and thank our sponsors. But when we head the next section, I'm gonna read you some quotes that are important to me and then some rapid fire questions. Is that okay?
Okay, that's fine.
This episode of LTC Heroes is brought to you by Experience Care, the only long-term care software developed by EHR users and clinicians every step of the way. Visit experience.care/guarantee to get your free profitability consultation today. All right. I'm going to read a quote to you that I think is really, really important. And it's from, let me find it here, from our president. It says, American nurses are the beating heart of our medical system. I'm interested in why you came on a cruise to hang out with a bunch of nursing professionals.
Oh, nurses are fun. Hands down. I mean, we like to let loose. We have a stressful job. So this is just, I think that what IntelyCare did for us is awesome. I hope you do it again next year.
Me too. I don't know if Susan or Rebecca or Brian or anybody else agrees, but I think that we have a platform and you and I are going to get this out and put some pressure on them.
Oh, I think that's a great idea. I know. I told my husband, I said, I hope they do it again next year. I would do it again.
Yeah. The reason I read to you that quote is because, the energy on the boat last night when we got together, everyone was dancing, and where I met you. And then tonight we have another party, and the next night we have another party. the people here are different. You know, we have an app, and everyone is commenting all day long, making jokes, sending pictures.
Oh yeah.
I guess I'm rather new. I've been a CNA for less than 9 months. What is it about nursing that draws you to nursing professionals?
You have to have a weird sense of humor. I don't know how else to say it. You really do. You have to be able to handle anything at any time. We're taught that in school, but you have to have the right personality,
Mhm.
and we're a little twisted. I don't know how else to explain it, but and we know when to be serious.
Mhm.
When it's a serious situation, to handle what we need to handle, but we also have to be able to calm down.
Mhm.
And so we relieve stress with our comedy. Nurses can be comedians.
Kim, I want to ask you a couple rapid fire questions.
Sure.
Do you have a favorite failure of yours? Something that you tripped and you fell down, but you got back up again and you're a better person because of it?
In nursing or
In life.
anything in life? Oh, geez. I wouldn't even know where to begin with those.
That's okay. We can skip.
Yeah, I have no idea.
All right. If you have the opportunity to rent a billboard somewhere close to Spencer, Ohio, with that millions of people are going to see over the course of a year, what would it say, and why would you put that on there?
Be kind to your elderly. And if I had anything, I would put at the administrators for all these long-term care facilities. They need to learn compassion, because a lot of the shortages and stuff that go on are because of the administrators. That's hands down. My brother's a physician. He was a physician, and he quit because of the administrators, because you couldn't get anything done.
Any advice for those administrators?
Yeah, get your head out of the sand. And that's a nice way to put it, because you're not treating your elderly, you're not treating the family. We're all one big family when we're working together, and we're working with these patients. They're family. And they're not treating them the way they should be.
Yeah. Kim, thank you for joining me on LTC Heroes Live. It was a pleasure meeting you,
Nice
and
to meet
I'll
you
see
too.
you around the boat, and let's go
sure.
put some pressure on IntelyCare to bring this back next year.
I'm okay with that.
Talk to you soon. And that wraps up what I hope to be a fun and insightful conversation from some of the frontline caregivers and leaders in our industry. A special thanks to IntelyCare, who made this event possible. This interview and many others this week were held at an event called IntelySea for Nursing Professionals Week cruise, held from May 9th to the 13th of 2022. IntelyCare set sail to reimagine and celebrate a new type of Nurses Week. IntelyCare, thank you for supporting our nurses. Now head over to www.ltcheroes.com/community and let's do care better together today. LTC Heroes is more than a podcast, it's a community.